Many of my patients ask whether it's best to place their breast implants above or below the pectoralis major muscle. The answer is, it depends on your anatomy and lifestyle, but for most patients, I recommend going below the muscle. If you're thin and have very small breasts to start with, the subpectoral or under the muscle approach is absolutely the best way of producing a beautiful, natural appearing result. And we've used this approach very successfully for many super fit patients who participate in fitness and figure competitions. For patients with more tissue to camouflage the implant, placing the implant above the muscle may be a good option. Before discussing the advantages and disadvantages of each, it's important to understand that when we talk about placing implants below the muscle, the implant will only partially be covered by the muscle. The pec major muscle is always released all the way across the inframammary fold during submuscular breast augmentation, so that the implant can settle down to a position that appears natural in relation to the nipple position. So implants that are under the muscle are truly only subpectoral in the upper part of the breast, essentially the cleavage area, and they're under the breast tissue in the lower part of the breast. There are several advantages to placing the implant partially under the pec muscle. One advantage is that an implant has greater tissue coverage in the cleavage area, so a patient's implants will be concealed more effectively and look more natural in revealing clothing. This is especially important in patients with thin tissue where visibility of the implant edges and rippling can be a problem. The pec muscle also flattens the upper part of the implant somewhat, which produces a more natural teardrop shape to the breast without an artificial-looking convexity in the upper pole. A second advantage that partial subpectoral placement provides is a lower risk of capsular contracture, where the fibrous capsule that your body naturally forms around your breast implants gradually tightens and thickens, making your augmented breasts feel firm and sometimes distorting breast shape and position. A third advantage is improved mammographic screening with subpectoral implant placement. 1 in 8 women in this country develop breast cancer at some point in their lives, so from a safety standpoint, this is an important consideration. The primary potential disadvantage of placing implants partially under the pec major muscle is that there may be some degree of animation of the implants, meaning that when you flex your pec major muscles, the central breast may flatten somewhat, or the entire breast may appear to move. In most cases, breast implant animation is minimal or even completely absent, and the vast majority of patients are not bothered by it. Recently, there has been a trend among board-certified plastic surgeons to perform more submammary or pre-pectoral breast augmentations. This is a reasonable approach for a particular subset of breast enhancement patients, those with enough upper pole soft tissue thickness, meaning skin, subcutaneous fat, and breast tissue to adequately conceal the implants. At Blue Water Plastic Surgery, we place implants in a submammary position for patients who clearly have enough natural tissue to conceal their implants in the social aspect of the breast, meaning the part of the breast that is visible in a swimsuit or revealing dress, and who are willing to accept that the implants may become more visible over time if their natural upper pole breast tissue gradually thins as they age. Many of these patients state that they're willing to accept a slightly higher risk of capsular contracture in order to completely avoid the possibility of any degree of breast implant animation with the pec major muscle contraction. Make sure that your breast implant surgeon can clearly explain to you the pros and cons of partial subpectoral versus submammary breast augmentation, and that they're making a recommendation that is clearly well suited to your own individual needs.